Segment today, we're taking a closer look at one of our most crucial organs. We're talking about our hearts. Dr. Darryl Elmouchi is a cardiologist who specializes in electrophysiology. So why don't you share with us exactly what that means? Electricity when it comes to our hearts, how do the two connect?
Sure. So I'm a heart electrician.
Okay.
I deal with abnormal heart rhythms. People can have fast rhythms, slow rhythms, irregular rhythms of their heartbeat, and they come to doctors like myself to help fix that.
And so there's a name for that, arrhythmia?
Yes, arrhythmia is an abnormal heart rhythm. Simple enough.
And so within that big umbrella category, there are a lot of different issues that arise, and you deal with all of them.
And we deal with all of them. I'm one of 7 electrophysiologists at Spectrum Health.
Okay, so why don't you walk us through sort of that physiology of the heart and kind of explain how you help people out?
Sure. So someone can have a normal heart rhythm, which I hope you do and I do right now. You can also have a rhythm that's too fast. Be sitting still and your heart's going 200 beats a minute, and we can put you on medications. We can put wires up from the groin into the heart and actually find the little area that's misfiring and destroy it. You can also have an irregular rhythm or too slow of a rhythm, and we can do all sorts of things to help people get better.
And so when we talk about our hearts, I think a lot of people think of things like somebody's having a heart attack or some of those blockages, those sorts of things. That's really not what you're specifically dealing with.
Right. So if you think of the heart 3 ways, there's pumping, there's plumbing, which is heart attacks and arteries, and then there's an electrical system. And we have different specialists to deal with each of those, and I solely deal with the electrical system.
And so when we talk about the electrical system, can this be something somebody who has typically a very healthy lifestyle, healthy heart rate, and then something just happens?
Absolutely. So you could be a child, a teenager, or a very healthy person have an abnormal heart rhythm, not always associated with the classic risk factors you think of age, high blood pressure, diabetes. You can be perfectly healthy and develop a bad heart rhythm.
And then what are the symptoms? Is this something that you would tend to feel? I'm guessing if your heart's going way too fast, maybe you feel that?
So the vast majority of people would feel palpitations, their heart racing in their chest. They may feel tired, lightheaded, short of breath, even chest pain, and in rare cases it can cause passing out.
Okay, and so then when you work on the heart, we have a video that's going to play. Will you walk us through exactly what we're seeing?
Absolutely. And so the video is showing now animation of the heart. And essentially, this is the most common abnormal heart rhythm we see, which is called atrial fibrillation, which is a fast, irregular beat. We take wires up into the heart and put them into veins that empty from the lungs into the heart, and then you'll see here a balloon that's inflating. That balloon fills with liquid nitrogen and actually freezes a rim of scar tissue around those veins, and the abnormal electricity within those veins no longer can enter the heart, causing the erratic heartbeat. And so this procedure, which is called a cryoballoon ablation, helps cure what is arguably the most common abnormal rhythm we see, and we do more of them than almost anywhere in the world, actually.
Is this an outpatient procedure that is done?
So it takes about 2 hours. We do them, and we usually keep people overnight just to observe them, but it's considered an outpatient procedure, and people can go back to work a couple days later.
So really not much downtime in terms of interfering with your life?
No, not at all. It's pretty amazing, actually.
All right, so to get this diagnosed, is that something that people would just get a hold of you, their primary care physician? How does that whole process start? How do you get diagnosed?
Sure. So all of the above. You might notice symptoms, feel something, and see your primary care physician. Most commonly, they would then refer you to someone like myself. But if you have symptoms of abnormal heart rhythm, you can contact us anytime as well. We're happy to find out what it is, and it could be one of many things, so it's important to diagnose it.
And we know you're part of Spectrum Health Medical Group, and there's a great offering called the Doctor Dialogue. Tell us what that's about.
So essentially, every year for Heart Month, which February will be, we do an interactive session where we bring physicians to talk to the community. This will be at the Meyer Gardens in, I think, February 18th. And it's a great way for people to come and hear a little bit more about healthy hearts.
And it's a complimentary dinner. It is always a way to draw people in the month of February. 5:30 beginning time. The dinner's at 6:30. If people are interested, they really should call and get reservations.
Absolutely.
You need a head count for this.
Absolutely, yes.
Fantastic. And then again, where can people find you and connect with you if they're interested?
So they can call our office, which is at 885-5000. It's the Spectrum Health Cardiovascular Group, and we're happy to see anyone.
Fantastic. Well, thank you so much.
Thank you very much. I appreciate it.
Nice to have you here on 8 West. And stay right there. More of 8 West when we come back.
Are you West?